you're having chronic hip pain, and you might even be thinking about having hip surgery to correct it, please watch this video first to see what may be actually happening with your hip that's causing your pain. So hip pain has a lot of varieties. You can have pain in the front of your hip in the groin area. You can have pain in the side of your hip, which is often diagnosed as bursitis pain or iliotibial band syndrome. You can have pain in the back of your hip, which is often diagnosed as piriformis syndrome. And you can have global hip pain, which is often diagnosed as arthritis. So there is one common factor that links all of these problems together, and that is how the hip is actually moving in the hip socket. And so the most common problem with how the hip is moving in the socket is something called an anterior femoral glide syndrome. All that means is that the femur head here is sliding forward in the hip socket excessively. And what that does is then it will pinch the front of the tissues in the front of the hip here, causing groin pain. Also, if you have a psoas that's sensitive, that's coming down here and inserting, it will also impinge the psoas muscle. On the side of the hip, because we have this IT band on the side here, under which we have a bursa. And if that thigh bone is not sitting in the right position, it will rub the bursa excessively, causing hip bursitis, inflammation of the bursa. And then in the back, if the hip is traveling forward too much, the little teeny tiny piriformis muscle in the back is trying to hold on to that big thing, causing it to become strained, causing piriformis syndrome, and maybe causing sciatic issues or SI joint issues. And then finally, because this has been happening for a long period of time, you may have cartilage breakdown in the hip socket, and so you feel, or your doctor feels, that you need to have a hip replacement to solve your pain. Well, I have helped a lot of people on the verge of having hip surgeries, replacements, and so forth by fixing the tracking of the hip in the socket, and this can happen relatively quickly and avoid surgery altogether. All right, so what is the key here? Well, what's going on is the reason the hip is migrating forward in the hip socket in the first place is because the big butt muscles aren't doing their job. And so the butt muscles attach from the sacrum here to the hip bone. And if they're not turning on well, then the hip bone starts to get sloppy, kind of like a washing machine that's out of balance. It starts careening around in that hip socket, causing damage. And like I said, it'll cause all of this other type of pain problems that we've been discussing. So the test that we're going to be doing today is to see whether your butt muscle is turning on well. And if it isn't turning on well, then likely what you have developed is an anterior femoral glide syndrome that is then causing your hip pain. Believe it or not, this can be corrected within a week or two, and you should have significant pain reduction as a result. So let's get started. So to determine whether your butt muscles are working well, you're simply going to put your fingertips on your butt muscles. All right? Now we don't want them down here where the crease is, where your hamstrings meet your butt. We don't want them way up here either. We don't want them out to the sides. And we don't want to use the palms of your hands. We want to use the fingertips. All right? So you're going to put your fingertips and dig them into your butt muscles right in the center of your butt. Okay, now what you're going to do is you're going to pinch your butt cheeks together and you'll feel them contract. What your job is to feel whether both are contracting the same and whether they both contract at the same time. And then you relax your butt muscles. Did they both relax at the same time? If you want to try that test again, go ahead and contract them again. Feel whether they're contracting at the same time, and then relax them again and see if they're relaxing at the same time, and also see whether they contracted the same on both sides. Okay, now we're going to keep your fingers right there. We're going to call that a 100% contraction, meaning that that's as much as you can get your butt muscles to contract. All right, and if it isn't, contract them even harder to feel what that 100% contraction feels like. Okay, good. Now that you've got it, relax your butt muscles completely, and all you're going to do is just simply keep your fingertips here while you walk around about 10, maybe 20 steps, and see whether you feel any of your butt muscles working at all when you're walking. Most of you with chronic hip pain will say that, oh, I don't feel either that hip the side that's hurting, I don't feel that that butt is working as good as the other side, if at all. That's indicating that likely you have poor butt performance, and therefore that's causing an anterior femoral glide syndrome that is then causing all of this pain in your hip. How do we solve it? Well, walking is the major activity that we do that we need those butt muscles to be working perfectly on. If you keep your fingertips on your butt muscles again and now walk around on your tippy toes, you might notice, oh, yeah, I feel those turning on better now. And what you'll likely feel is that they're turning on maybe 5% of your max or 10% of your max. And that's all that's necessary for your butt to work correctly. So then the key is, okay, what happens if you're walking around on your tippy toes and you feel your butt turning on now? What happens when you start to bring your heels back down? Does your butt still stay turned on? Many of you will say, yeah, it stays turned on at least for a few more steps and then it starts turning off again. So that's good news because your butt is able to turn on and we've temporarily fixed your walking pattern so that is carrying forward for a few steps even after you're done tiptoe walking. So basically what you need to do is solve how you're walking to turn on your butt muscle, which then corrects the tracking problem in your hip socket and removes your pain. In fact, what would be a really interesting test is if your pain happens when you're walking, to go up on tiptoe walking and see if your pain is reduced when you're tiptoe walking. If your pain is reduced while tiptoe walking, this is further evidence that your pain is due to an anterior femoral glide syndrome and that it can be immediately changed just by getting the butt to turn on better. So I'm not asking you during the day to contract your butt muscles and walk around with them pinched together all the time. That would be unnatural. What we are going to talk about today is how to fix your walking pattern so that it turns on your butt muscles. All right, so you've already gotten a clue. Something about tiptoe walking is turning on your butt muscles that your regular walking isn't doing. What are those things? Well, there's two things happening with tiptoe walking that isn't happening with your normal gait. One is that when you're tiptoe walking, your knee is remaining soft the entire time. It never gets to lock. And the other thing is that when you're tiptoe walking, as the foot is advancing, the body is advancing with the foot instead of the body landing here behind the foot. And so here's what that looks like. Typically, when most people are walking, they are sending a foot out, heel striking, and their body is still behind them. When that heel strikes, what happens is the knee then locks straight. When the knee locks straight, that turns off the butt muscle, and it stays turned off as you pass over the body. So now your whole pelvis and leg and hip are unprotected by your butt muscle because it's turned off, because you've locked the knee, because you've done a heel strike out in front of your body. Tiptoe walking, you'll notice, it's impossible for your body not to move forward with that foot. You can't tiptoe walk and have your body behind you like this. It just doesn't work. And you'll also notice that tiptoe walking, your knee is constantly bent when you're landing on that leg. So if you can learn to let your body come forward with the advancing foot while you're walking, your knee will start to unlock and your butt will start to turn on all by itself. That is what is likely turning off your butt muscle and therefore causing the anterior femoral glide syndrome, which is then damaging all these other tissues in your hip. All right, so tiptoe walking again does this very easily and naturally. You don't have to think about it. It just turns on, and then you lower your heels down and you notice that it stays turned on. So one of the things I recommend a lot of people do if this is their problem is every time they stand up from a chair that they take the first 5 or 10 steps tiptoe walking to start fixing their gait pattern while they're walking around. And then throughout the day, think about your walking pattern. And if it's too much to think about, if you're too busy, then just go back into the tiptoe walking again, and that will fix it automatically for you. But at some point, we need you to start thinking about your gait pattern and fixing that and letting your body move forward with the foot instead of your body lagging behind the foot when you're walking. All right, so if you have some other pain in your body or even more hip pain questions, put them in the comments below and I'll try and make a video for you to answer your questions for you. Now, a lot of this information is covered in my new pain patterns book, and I've made videos of each of the chapters for my pain patterns book on my YouTube channel. And so this is the first one, and I would strongly encourage you to watch those to learn how I see the body differently than most other practitioners. And I call that a systems thinking approach, understanding how the whole body works together as a system rather than a component thinking approach, which is just focusing on a tissue that's irritated and trying to get that tissue not to be irritated. This systems thinking is much more successful for fixing chronic problems. Component thinking is much better at solving acute problems, problems that have only been around for a few weeks or a month or so. So either purchase my book on Amazon or watch those videos on YouTube. Now, I also have a hip pain digital home program that's found on my rickolderman.com website. So you'll go to the Fixing You Programs tab at the top and just scroll down and you'll see the hip pain program there. It's very affordable. It'll take you through all of the exercises and help you fix all of the problems that are causing your hip pain. It's been very successful for a lot of people, and I think it will probably help you too.